So today we're going to talk about what are the causes of depression, anxiety, and anger. So the first thing we need to check to see where is the source of it, as we said, and the source of it is in trauma, always. There was a trauma when a person was innocent, and because he was innocent, he was traumatized. He wasn't ready. He wasn't ready for the trauma. He was just totally innocently going by life, and suddenly trauma happened. So now he's horrified of being innocent. The thing that he wants to get rid of most is innocence. It actually is a threat to him to be innocent. So he wants to get rid of innocence, and he starts becoming cynical or a realist. He starts watching life, what's going to happen, what could attack him next. So he becomes too much of a realist. He starts thinking of all the things that could go wrong in life. He starts noticing the negative things in life instead of being innocent and looking at what's good in life. He doesn't want to see the positive, he wants to see the negative, because in this way he's prepared in case another trauma happens. So the negativity is an illusion of preparedness. So a person doesn't want to be all innocent, going around life, and suddenly be traumatized again. So he starts watching, where is the negative? I'm going to be prepared. Who's going to talk about me? What's going to happen? Who's going thinking this about me? All these people, he starts labeling people, and the 10 forms of negative thinking start to develop. And he might not have all of them, but he would have some of them. And when he thinks negative thoughts and he sees what's negative in life, okay, it gives him a false sense of security. He doesn't want to see what's good in life, because then he'll be all innocent again and he might get traumatized. So he starts thinking, labeling people, personalization happens, because of me this happened, and as we said, all these 10 negative thinkings, which some people call it twisted thinking, I like to call it negative thinking, they develop. Once they develop and he thinks those negative thinking over time, okay, it causes him to have the three frozen emotion. We have depression, anxiety, and anger. So now what do? Well, once we have the trauma and the lack of innocence, and the person wants to be a realist, okay, we can't just tell him, no, don't be afraid, you're not going to be traumatized anymore. We need to go first into the trauma and fix the trauma, empower him, create a positive experience from the trauma as much as we can. We need to give him some tools to see that if this trauma happens, he can take care of himself. So by somatic release, we release the trauma. We actually physically release the trauma from the person's body. So now, instead of being traumatized and braced and afraid to be innocent, he's willing to be a little bit more innocent, because maximum trauma will come, I'll handle it again. Once he's empowered by that, okay, then the negative thinking start going down a little bit. He's not so negative. He's willing to look at some positive thinking, positive things in life. And now, instead of his heart controlling the everything, the mind starts controlling the heart. So if he comes with some negative thinking, with the mind, he would start talking back to those negative thinking. It's not a given. Negative thinking is a negative thinking, and that's it. He starts talking back to it and fighting it. We do that through charts. We do that through all kind of tools, self-talk, and when he starts doing those charts and then work on the negative thinking with, we call that CBT, then the negative thinking starts going down. And once he does that, the depression, anxiety, and anger start going down. But once he got rid of his negative thinking, suddenly things start getting clear. He starts seeing that maybe he's annoyed at somebody, and rightfully so. So now when he sees that he's annoyed at somebody because someone crossed his boundaries, so then he can set a nice boundary and get the good result, and life is much better. So through the system of the 3 to resilience, we have an answer to every one of those stages. For the trauma, we do a corrective experience and we do a somatic release, sometimes through corrective experiences, sometimes through other things. With the negative thinking, we work on controlling, having control of the mind over the emotions, and depression, anxiety go away. If anger still exists, we create boundary work. We do boundary work. What happens then is that what the emotions, the emotions that were actually frozen emotions, the emotion of depression, the emotion of anxiety, and the emotion of anger, where you're so high, you're so highly emotional, where it freezes you, can't even do anything about it. Now that we worked on it, those 3 emotions start changing from a frozen emotion to a movement emotion. What does that mean? With a frozen emotion, like you're depressed, you're so depressed that you can't get out of the house, you can't get out of bed, so you're frozen with it. Now you're feeling, once we did the work, you're feeling better, and the emotion of depression might become sadness. In depression, there's no movement. In sadness, there's movement. You do something about it. So I had some clients that when their father died, he was 85, and he died. So they made a word in his memory in the hospital. They actually did something in his memory. They weren't frozen with depression. They were sad, so they did something about it. Someone's mad, for example, was a lady that her son, if I remember correctly, was killed in a car accident, or her daughter. So she made an organization, MAD, Mothers Against Drunk Drivers. She did something about her sadness. She wasn't frozen with it. So she was a healthier person. Anxiety, which is a frozen emotion. I'm frozen with an anxiety. My heart is pounding and I just don't know what to do about it. So anxiety becomes the movement of emotion of fear. Fear is a normal emotion, is a good quote-unquote emotion, because you might be in a dangerous situation and your fear tells you to remove yourself from the dangerous situation. So anxiety, the frozen, turns into fear, movement emotion. Then we have the anger, where someone is so angry that they can't even talk, or even if they're not frozen, they might be destructive, breaking things and breaking relationships. So anger, once we work with a person and we work with what we described before, the anger turns into being annoyed. Okay, so now the person is annoyed at this, I'm not angry, I'm annoyed. So now I can set the boundary. I can do the movement of setting a boundary. It is important to realize that in the work of looking for trauma, okay, sometimes we sit with a person and we start working on his traumas, and another trauma comes up, and another trauma comes up. People have sometimes endless traumas, at age 2, 5, 10, 12, 20, and then you can get caught in fixing all the traumas. It's not like you have to find all the traumas and only then you'll be happy. There is a connecting trauma. There is a pattern to all these traumas, and a good therapist needs to be able to see the pattern of what's in common to all these traumas and work on the pattern rather than individual traumas. And when he does that, the person becomes empowered, and he doesn't need to work on every trauma. He can just work on the pattern. Once he fixes that, then everything starts falling in place. The negative thinking goes away, and the frozen emotions go away. And then the depression, anxiety, and anger become a lot lower, and he feels a lot better. So it's important to notice the pattern.